The top stories and web searches across Texas for weeks have included something related to mask mandates. Meanwhile, we've seen an increase in the number of children hospitalized with COVID, especially as school goes into full swing. Sonia Azad spoke with a doctor about kids and masks when it comes to schools.
I wonder if you can settle this argument for us once and for all. Do masks work in terms of mitigating risk or reducing risk of transmission?
Absolutely, masks work. Does that mask help prevent, especially when there's a infection that comes out of your mouth? So we really do recommend that everyone who's inside of a school building, whether they're vaccinated or not, that they should wear a mask. And that even if it's not mandated, as a parent, you want to protect your children. It's the right thing to do.
My niece and nephew, they're in third grade, kindergarten. They go to meet the teacher, right? I mean, this is historically, traditionally a big deal. You're excited. And my sister sends me pictures. I'm like, why is that teacher not wearing a mask? Why is the child not wearing a mask? What does the data tell us about, the time around someone, even without a mask on?
Initially, we were saying 15 minutes, but now with the Delta virus, because the Delta virus, it makes so many viral particles and it spreads so fast, it's probably reduced. So it's less than 15 minutes around someone who has Delta, and you can be exposed and infected.
School starts last week. This week by Monday, hey, here's a letter that says, okay, Mrs. So-and-so, a child in your kid's classroom has tested positive for COVID. So what does a parent do when you receive that kind of letter? When should they get their kid tested? Should they get themselves tested? Oh my gosh, the kid went to a birthday party or saw grandparents the weekend before. So what is the process?
If your child has been exposed, rather than guessing about it or waiting for it, you should go and be tested. Your child should, especially if you intend to go and see grandparents. Until the quarantine time is over and you're sure your child is safe, don't let them go into multiple different environments where they may be spreading the infection.
The appropriate window when you should get tested or when you should get your child tested if they do bring one of these letters home.
With the Delta, it seems like people are positive 2 days afterwards. And so what I would tell you is that the time period is still probably around the 3, 4, 5 day range, but you may get symptoms as soon as 2 because it's such a rapidly changing variant.
And again, that was Sonia Azad. Now, Dr. Orlowski also said a realistic timeline for COVID vaccines for children between the ages of 5 to 11 is late this year or early 2022. Researchers are still conducting data on clinical trials.